Breast density is an emerging significant risk factor for breast cancer. Breast density is assessed during a mammogram. It is calculated based on the amount of fat in the breast tissue as compared to the stromal elements and ductal tissue within the breast. The fatty tissue is radiolucent and makes the mammogram easier to read. Breast density may decrease as women age, but not in all cases. Breast density is graded on a mammogram, A, B, C, or D, but there are also standard phrases used to describe these categories. The standard grading system for breast density is the BI-RADS breast density score. A BI-RADS A score describes breast tissue that is almost entirely fatty. In a BI-RADS B mammogram, there are scattered fibroglandular densities in the breast. In a BI-RADS C, the breasts are heterogeneously dense, and in a BI-RADS D, the breasts are extremely dense. Some mammogram reports do not include a BI-RADS density score, but instead describe the breast tissue as above. The majority of women have breast densities in the B and C categories. 10% of women have breasts that are almost entirely fatty, and about 40% each have breasts in density category B and C. The final 10% have extremely dense breasts or category D. These pictures of mammograms demonstrate the different density categories. Density category A is almost entirely fat and radiolucent. Contrast that picture with density category D, extremely dense breasts. Normally, abnormalities show up as white, which is harder to see in mammograms with density C or D. Breast density is an independent risk factor for breast cancer, with odds ratios between 2 and 4 for the highest density category. This is in addition to the fact that mammograms are harder to read in women with dense breasts. Breast density accounts for a substantial portion of non-familial breast cancers. Breast density also affects sensitivity of mammography. This table demonstrates that as the density increases from category A to D, more women are called back for extra views after a screening mammogram, and the overall sensitivity of mammography decreases from 89 to 64% in the highest density category. Breast density is determined on a mammogram. There is little correlation between clinical breast examination and mammographic breast density. There is also no relationship between breast size and density. Many states have passed laws requiring that women get a letter including their density category after having a mammogram. It is unclear what testing, if any, is needed in women with dense breasts. There is no evidence that additional tests such as ultrasound or MRI improves mortality in women with dense breasts. Some studies show that adding screening ultrasound to mammography finds more cancers, but also generates additional false positives and biopsies. MRI should be reserved for women at high risk of developing breast cancer. Clinicians may use breast density in discussion of overall breast cancer risk with women. Screening decisions should include a discussion of risks and benefits of mammography.